carrying on a dental topic this morning. We're talking preventative care. Dr. Phil Wenk is back with us. So happy again to have him again this morning. He's the CEO of Delta Dental of Tennessee. Dr. Wenk, thanks for coming back.
It's always a pleasure. Great to see you.
Good to see you too. So, importance of a routine of preventative care. What does that mean?
Well, it means the same thing that you would think about with your doctor, your physician. The difference is that with dental injuries or dental situations, very few of them come on very fast. In other words, you don't wake up one day and go, I didn't have a cavity there yesterday, but it's there today. These things take a little while to get there. So in most cases, what we recommend is two visits a year for preventative treatments. So what does preventative treatment typically consist of? Well, the first thing it typically consists of, depending on age, is an exam. So that's where you go through and check and make sure nothing's changed or nothing's loose or nothing's causing any problems. And even worse than that, especially in adults, are there any oral lesions? And the reason I brought that one up is oral cancer is one of the most prevalent cancers in America. And so we want to always make sure the dentist is checking carefully for that. So when we get into the children's side, the whole idea about preventative treatment with them is if they're maintaining good oral hygiene, they're doing the things they should do, and the parents are doing a good job of monitoring those. Really what you're doing is you're going through making sure no changes that. But then the other thing is, and this would seem non-preventative, but it's very important. If you're in what they call a transitional thing, so you got some baby teeth and you're starting to get some adult teeth, and you got a few coming in, that's a good time for the dentist to see if there's going to be a problem with crowding, with your teeth erupting properly. Are they going to be in the right place? So preventative is not just preventing diseases. It's also preventing a situation from developing that's going to be very expensive to fix a year, 2 years, 5 years down the road. And a lot of orthodontic situations that are going to have to be addressed, you can begin to diagnose that at about 8 years old. So there's a lot of things involved in that. So what do? They're typically, most of us know what it is. It's going to have an exam. There's routines about having radiographs or x-rays. Those are done to make sure in young people that the teeth are lined up. It's not uncommon, by the way, to know that there are teeth that are so crowded that they can't even come in. So those are things that x-rays will pick up early. So with preventative, you're not only preventing decay. With adults, you're preventing decay and gum disease. And the third one is, in young people, you're preventing eruption or unfortunate eruption that goes in the wrong place or isn't occurring at all. So there's a lot of things that roll into that. The treatment is pretty straightforward, but it's something that can surprise you in 6 months what can change.
So you said we need to visit the dentist at least twice a year. And I hate that I'm going to admit this to you. I'm guilty. There was a couple of times I was like, you know what? I'll put it off. I'll just go the next time around. Why is it important for us to keep that appointment, or could it be bad if we skip it?
Well, we talked about decay and gum disease. They don't happen overnight, but they can begin to happen easily in a year. Okay. And so what you just said to yourself was, it's okay, I don't have to worry about it. And in most cases, Stephanie, you really don't. An adult who's got good oral hygiene and that sort of thing. Now, I didn't come on here to say, don't get your teeth checked and don't get your teeth cleaned. So let's not go down that rabbit hole.
Right.
What I am trying to point out is, in most cases, you're going to be fine, in most cases. But the problem is, the longer you go, the more it becomes less and less opportune for you to continue to be safe and healthy and that sort of thing, and more for problems to arise. And then in adults, one of the big things with adults is gum disease. And more adults will lose teeth in America from gum disease than will from decay. And that's when real problems arise, because when that happens, most of the teeth don't only just have to be removed, some of them will even become incredibly painful because you can't chew. They're just wobbling around in the mouth. So those are the kind of things that you want to make sure of. You can keep that from happening with routine evaluations, because the dentist is going to go through and pick at certain places. What they're doing is making sure that bone that holds that tooth in place is stable.
Two more questions for you. One being, as we're doing our preventative care, what about flossing?
You should floss at least once a day if you can. Flossing is one of those things that the more you do it, the better off you are, because bacteria doesn't sit on the top of the tooth. Bacteria forms around the edges of the tooth or in areas where there's not a lot of ways to wash it off. So the smoothest surfaces are less likely to have bacteria stick on it. The reason you get decay in the top of the tooth is not because it's not relatively smooth. It's because it has real deep grooves in it, and the bacteria sticks down in those grooves. So those are things to think about as far as that goes.
Well, last question then, how does our dental care actually impact our overall well-being, our overall health?
Well, let's think about that in two ways. You were making a statement about getting a tooth knocked out and about having teeth in your mouth and what all it means. Okay, let's start with just the obvious, your smile. Without a smile, people have a tendency to become introverted. They have a tendency to be reticent to speak in public. They have a tendency to hold their hand in front of their face. So if I was talking to you like this whole time, you wouldn't have held much value in my discussion. So what happens in that case is the emotional effect of the fact that suddenly you are considered to be lesser of a person. If you lose front teeth, your grade for being a person who's going to get a good job goes down. So those are some things just on the emotional side of that. Then the other side is just eating. The way we take in our nutrients is by chewing food, grinding it up, creating a pulp, and swallowing it. So when you think about all of that, just in the process of doing that, if you scarf your food down, you don't swallow properly, you do the things you shouldn't do, first thing is you get choked. Second thing is, more importantly, digestion becomes much harder. So if you eat a lot of red meat, especially a lot of fatty red meat, what you'll find is the body takes a long time to get it passed through. You've had a late night meal and, rushed it in, you ate some stuff that was probably really stupid to eat. And when you did, sometime that night, you probably didn't feel very good. Well, that's because you didn't get it ready. It didn't get ready to get in. So that's important. And then the other thing you look for is all the other health issues that arise. The opportunity for cancer to become a problem, especially people who smoke, people who use dipping, chewing tobacco, that sort of thing. Those are all vaping. Those are all people who will be far more prevalent to get oral cancers. As I think told you, it is the most prevalent, one of the most prevalent cancers in America in everybody. So it's very common to have that. And then the other thing you look for is gum disease. So these are all interior to the mouth. Then the other thing you can begin to look for is the gums will take on different hues or colors if other systemic diseases begin to arise. So if you were to have, as an example, leukemia, the gum will have a tendency to turn a little white. Those are the kind of things you look for, because gums aren't supposed to be white. They're supposed to be pink and or pigmented, but they're not supposed to be white. So there's a lot of things you look for that are very simple. The other thing is, because the mouth is full of bacteria, it is the breeding ground for bacteria in your body. And if that's the case, and you have other health issues, it will exacerbate the ones you started with. It'll make diabetes worse. It'll make heart problems worse. They will all become kidney problems. They'll be worse. So that's a frightening thought.
Preventative care is incredibly important. Dr. Phil Wenk, thank you so very much for all of the information you have provided today. You've given us a lot to think about. People out there, go see your dentist.
Thank you.
Anytime again, Dr. Phil Wenk, CEO of Delta Dental of Tennessee.